Picture this. You're at home alone, maybe reading, maybe watching TV, when suddenly you feel it. A heavy pressure grips your chest. Your arm goes numb. Your breath shortens. You realize you might be having a heart attack. It's a terrifying moment, and for over 380,000 Americans every year, it's a reality. Many of them face it completely alone with no one around to help. Here's the shocking truth. A study published in the European Heart Journal found that seniors who knew exactly what to do within the first 60 seconds of a heart attack increased their chances of survival by 73%. Yes, 1 minute can make the difference between life and death. Even more alarming, research shows that nearly 9 out of 10 people over 60 have no idea what the correct steps are when a heart attack strikes. Many panic, freeze, or even take actions that make their condition worse. Today, you're going to learn 7 scientifically proven techniques that can dramatically improve your survival chances if you ever face this frightening situation alone. These are not myths or internet tricks. They're methods backed by leading experts from Johns Hopkins, Mayo Clinic, and Harvard Medical School. In fact, the #1 tip I'll share was found to give the same survival advantage as having a paramedic standing in your living room. And it's not about taking aspirin. Let's begin. Tip number 7. Create your emergency communication system. This might sound simple, but it's absolutely vital. When every second counts, confusion can be deadly. During a heart attack, your brain starts losing oxygen almost immediately. Within 15 to 30 seconds, your ability to think clearly or even recall basic information, like your address, can vanish. A Journal of Emergency Medicine study found that 67% of heart attack survivors over 60 couldn't remember their own address when calling 911. So prepare now. Write your complete address and phone number on a brightly colored card and tape it next to every phone in your house. Include entry codes or special instructions. On your cell phone, program 911 as speed dial number 1, because when your hands are shaking, pressing a single button is far easier than dialing 3 separate numbers. Keep your phone charged and within reach, especially at night. The American Heart Association reports that 43% of fatal heart attacks happen between 10 p.m. and 6 a.m., when phones are often out of reach. If you live alone, invest in a medical alert device, but here's the key. Wear it all the time, even in the shower. The National Institute on Aging found that nearly 1/3 of seniors who owned these devices weren't wearing them when their cardiac event occurred. Lastly, inform a trusted neighbor about your condition. Give them a spare key or entry code and ask them to check in if something seems off. These few steps could save precious minutes and your life. Tip number 6. Master the cough CPR technique. This method, once debated, now has scientific support when used correctly. Cough CPR, or cough resuscitation, works by generating pressure inside your chest to keep blood flowing to your brain when your heart's rhythm becomes unstable. In a study from the Peking Union Medical College, patients who performed cough CPR correctly during early heart attack symptoms remained conscious for an average of 92 seconds longer, enough time to call for help or take emergency medication. Here's how to do it properly. At the first signs of a heart attack, chest pain, dizziness, or shortness of breath, take a deep breath, filling your lungs completely. Then cough deeply and forcefully from your diaphragm, as though you're trying to clear something lodged in your chest. Repeat this rhythm. Deep breath, hard cough, deep breath, hard cough every 2 seconds. Each deep breath oxygenates your lungs, and each cough compresses your heart, manually keeping blood moving. However, note this carefully. This only works if you're conscious and if your heart rhythm is irregular, not if you're having a full blockage. It's a temporary measure while waiting for emergency help, not a replacement for 911. The Cleveland Clinic emphasizes that it's most effective within the first 30 to 60 seconds of symptoms, so knowing it in advance is critical. Tip number 5. The aspirin protocol that actually works. Most people know to take aspirin during a heart attack, but very few know how to take it correctly. Research from Harvard shows that how you take aspirin can affect how quickly it starts working. And in emergencies, speed is everything. When a heart attack strikes, a clot usually blocks blood flow in a coronary artery. Aspirin helps by preventing that clot from growing. A massive Lancet study involving 17,000 patients found that taking aspirin within 1 hour of a heart attack reduced deaths by 23%. But here's the key. You must chew the aspirin, not swallow it whole. Chewing breaks down the tablet, allowing faster absorption through your mouth's lining. A University of California, San Diego study found that chewed aspirin reached effective blood levels in 14 minutes, compared to 26 minutes for swallowed tablets. That 12-minute difference could save your heart muscle, or your life. The correct dose: 1 regular 325 milligrams tablet or 4 baby aspirins, 81 milligrams each. Keep uncoated aspirin in several places, at home, in your car, even in your wallet, and check expiration dates regularly. If you already take a daily low-dose aspirin, still take this additional emergency dose when symptoms appear, unless your doctor has advised otherwise due to allergies or blood-thinning medication. Tip number 4. Assume the cardiac position. The way you position your body during a heart attack can significantly influence your survival. According to the European Resuscitation Council, proper body positioning can help maintain consciousness and stabilize blood flow. Here's what to do. Sit upright at about a 45-degree angle, supported by a wall or pillows. Keep your knees bent with feet flat. This is called the semi-Fowler's position. It reduces the workload on your heart, improves breathing, and prevents fluid buildup in your lungs. A Tokyo Medical University study found that patients who used this position had 35% better oxygen levels than those lying flat. If you begin to feel faint, carefully lower yourself to the ground and lie on your right side in the recovery position, left knee bent for balance. This keeps your airway clear and prevents choking if you vomit. Loosen tight clothing, belts, collars, ties, and open a window for fresh air. A Journal of Cardiac Nursing study found that loosening restrictive clothing improved oxygen levels by 8% during cardiac distress. Stay calm, stay cool, and conserve your energy. Tip number 3. Use controlled breathing. During a heart attack, panic makes things worse. Rapid, shallow breathing deprives your heart of oxygen. A Stanford University study with 300 cardiac patients found that controlled breathing reduced heart muscle damage by 45% compared to those who hyperventilated. Here's the correct technique. Inhale slowly through your nose for a count of 4. Hold your breath for a count of 4. Exhale gently through pursed lips for a count of 6, as if blowing out candles. That long exhale activates your body's relaxation response, lowering heart rate and blood pressure. The Mayo Clinic reports that this can slow your pulse by up to 15 beats per minute and relax blood vessels, improving circulation. Practice this method regularly when you're healthy, so when an emergency comes, it's second nature. Tip number 2. The door unlock and signal protocol. This may be the most overlooked but life-saving action you can take. Thousands of people die every year because paramedics simply can't reach them in time due to locked doors. A Journal of Emergency Medical Services study showed that locked doors delayed treatment by 11 minutes on average, and 34% of deaths in cardiac events were linked to this delay. So, the moment you feel heart attack symptoms, unlock your front door immediately. Leave it slightly open if possible. A University of Pennsylvania study found that patients who unlocked their doors right away had 47% higher survival rates. Install a key lock box outside your home and give the code to your local fire department. This alone can cut response times by 8 minutes, according to the National EMT Association. At night, keep your lights on so paramedics can spot your home quickly. If you live in an apartment, call the front desk or security after calling 911 to guide rescuers. Every minute matters. Don't let a locked door cost you your life. Tip number 1, the immediate nitroglycerin protocol. This final tip is perhaps the most powerful. A Harvard Medical School study found that using nitroglycerin correctly within the first 3 minutes of heart attack symptoms can offer the same survival advantage as immediate professional intervention. Nitroglycerin relaxes and widens blood vessels, improving blood flow and easing strain on your heart. A British medical journal study of 12,000 patients showed that early nitroglycerin use reduced deaths by 35% and cut heart muscle damage by 50%. If you have heart disease risk factors, like high blood pressure, diabetes, or high cholesterol, talk to your doctor about getting a nitroglycerin prescription. Here's the correct protocol. At the very first symptom, sit down immediately, never stand. Place 1 tablet under your tongue. Do not swallow. Let it dissolve completely. Wait 5 minutes. If symptoms persist, take another tablet. Wait another 5 minutes and take a third if needed. Never take more than 3 tablets in 15 minutes. Keep your nitroglycerin in its original glass bottle away from heat and moisture. Replace it every 6 months and store it in multiple spots in your home and car. If you take medications like Viagra, Cialis, or Levitra, never use nitroglycerin within 24-48 hours. The combination can be fatal. Also, chew an aspirin before using nitroglycerin. The two together, aspirin to thin the blood and nitroglycerin to open arteries, can increase survival by over 50%, according to Johns Hopkins. Final thoughts. These 7 steps could truly mean the difference between life and death if you ever face a heart attack while alone. But knowing them isn't enough. Practice them. Review your plan, check your supplies, and make sure your emergency system is ready today. Share this video with your loved ones, because one day this knowledge could save their life too. Heart disease remains the leading cause of death for people over 60, but preparation and awareness can dramatically change the outcome. Stay informed, stay prepared, and stay alive.